Welcome back to All Angles. Now, at least 1 in every 8 people is affected by mental health issues, and that's due largely to financial difficulties, conflict and violence. As we mark World Mental Health Day, let's speak to Professor Ramneek Ahluwalia from Higher Health on how we can prioritize mental health in our daily lives. Thank you very much for joining us this afternoon. And it's actually been described, this alarming rate of increased mental health issues and the like, as a growing pandemic around the world. So obviously this is a really dire situation that many countries, including ourselves as South Africa, find ourselves in.
Absolutely, and good afternoon to everyone, and good afternoon to you. It is probably the biggest pandemic the world is experiencing and the most fastest growing pandemic. 1 billion people in the world, as per the latest WHO 2020 study. It's a huge number. 1 in 5 young people in South Africa are experiencing mental health challenge. And in fact, 4% of the total young population experiences severe mental health. So these are really alarming numbers. If I say in every 4 seconds there is a death in the world due to suicide, these are real numbers. And also, it's just not the word suicide. It takes 20 attempts of suicide to one fatality that we see, which is the actual suicide. So imagine how deep this pandemic is, how grievous this pandemic is. And I think what ENC is doing, what we need to do, is continuously break the stigma of mental health, because the biggest fight we have against mental health is its stigma. Is how we educate people, how we bring, because if you look at the data again, 75% of the onset of mental health problems in a lifetime is before the age of 24. And in fact, 50% of all the onsets is before the age of 15. What is trying to indicate is young people, youth, where the onset of mental health starts. Because in any disease, whether it's COVID, whether it's diabetes, hypertension, including mental health, what you do not want is to diagnose a disease late, because then it's very difficult to revert the patient or the individual back, because sometimes it becomes irreplaceable. So what we have to do is early interventions, early knowledge, break stigma. And that's exactly what we need to do, and that's exactly I'm grateful ENC is trying to do.
What is the big issue? Why are people struggling so much in their daily lives? And the fact that they don't talk about it speaks to that stigma, and that if I tell people that I'm feeling this way, it might come out as a problem. But what are people going through? Is it just the state of the world at the moment, the pandemic? What exactly can we pin this spike in mental health issues that we are seeing?
See, there are no spikes. The mental health has always been existent. It's been one of the biggest pandemic or epidemic. But yes, there are reasons and factors when mental health does exaggerate or it brings. One of the factors is always genetic. This disease is genetic, which means if your family has a history of mental health, one is at high risk of getting mental health. But the other factors are the overlying factors, or the factors that bring mental health or induce mental health, where the genetic predisposition makes it early onsets or far more challenging for an individual. And factors, you're right. What we're experiencing in South Africa is if you look at our country, it's 27-year-old. It's a young country. Most of the children or young people that are born of single parents. They've growing up seeing abuse. Financial distress is massive all over the world now. After the Ukrainian war or COVID, it has become far more deeper. So financial challenge, academic stress, uncertainty about the future, domestic violence, partner violence, alcohol and substance abuse. So diseases in general. Everything at the end mounts to mental health, because it affects the psychosocial distress into an individual and triggers the mental health as a pandemic or a disease in general. So I think the factors remain multiple. They are unique to South Africa. There are also similarly in the global system. And I think the aim is resilience, the aim is empowerment, the aim is education, the aim is building, and in fact, knowledge to the parent and guardians who are looking after the young children, that they have to be very, very sensitive and careful, watch out the symptoms of mental health at early stages for their children, knowing that the onset is at a very young age, applies to universities, applies to colleges, applies to high schools. These are very important instruments that where we need to now put mental health education forefront, identification of symptoms forefront, making people understand what's mental health, and cracking the stigma through participatory approach, through peer-to-peer involvement. And I think we need to tackle this as a disease, as a huge pandemic, and keep it as a KPI or a key performance area at every institution, whether it's a university, college, school, or an employer, considering the magnitude we see in the world.
And maybe let's talk through those symptoms, Prof, because the research also says that adolescents and young adults are at higher risk of committing suicide. So obviously they lose complete hope and they decide to take their own lives. And that is quite scary. And the rates at which it's happening is also quite alarming. So when we're talking about symptoms in a young teenager or a young adult, what are we looking out for here?
Absolutely. I think that's very, very critical. So the challenge is, before I even attempt the word symptoms, is that once somebody starts understanding mental health, it has to be respected by the individual the person is trying to confide in or telling him or her the symptoms, because where mostly the problem happens is if a parent or guardian or our culture or our society starts seeing, okay, it's spiritual, you're dinging too much, or sidelining mental health. So a parent or a guardian or an individual needs to identify this at a very young age about their children. When, for example, you start experiencing your children when they're isolating themselves. Why? You have to ask themselves. They're not eating well. They are not sleeping well. Their attention is now minimal. They are not doing their studies or qualifying their studies in the same way like they used to. If you start seeing changes in the pattern of your child who's not now isolating, not sleeping well, not talking, not eating well, you should be alarmed. You should think about that this could be something that I need to be worried about. I need to be able to ensure that I bring help to this young person, because early intervention can reverse a lot of challenges that will eventually lead to an adolescence, to a stage which will be then going to a level where he or she starts looking into severe depression, severe anxiety, severe panic disorders, and then leading to what we call it as suicidal attempts or suicidal ideations, or eventually what we lose is a young person or an individual through suicide. So it's very early detection will help going long way in preventing what can be a very fatal outcome of a disease. So getting help early is very sensitive, but identifying the individual is more critical. And for that reason, education is sensitive. Education to the communities, education to our parent guardians, education to young people, understanding this disease and manifestation of the disease, doing early risk detections or early risk profiling. We've got assessment tools that are available in community, and normal average South African can do it at the age of 15, 16. Higher Health is doing it. Last year, about 100,000 students themselves did it. And then linking to early care goes a long way. So I think that's where we have to watch out and what we have to do.
Prof, I suppose one of the difficulties here is the access to institutions or facilities that can help. South Africa is plagued by that issue in that there aren't enough public platforms where someone can seek help for free. And those who can get help have the money to get it from private providers. So that is that difficulty. How do we deal with that, the access, and making sure that people can have an opportunity to get the help that they need should they need it?
selfishly, I'll start with the number. If people can note, it's a higher health toll-free crisis helpline for young people. 0860 363636. So 0860 363636. This number should be always there. It's totally free, 24 hours, 2 o'clock in the morning, 3 o'clock in the morning. Pick up a call. Do not live with this alone. Speak about. There will be a social worker, a counselor, and a psychologist available around you who could deal with this at a time of crisis when you need somebody to confide in. And these are very important tools that are around us. Similarly, there is a challenge of access of psychologists in our country and globally, access of psychiatrists. And there's a conscious effort that the government has to now further invest into primary health of mental health and putting more infrastructure. But certain help are around and are totally free and needs to be done, because from there, a referral pathway will decide for a long-term intervention. But in a short term, a crisis can be managed intensively through the experienced people who know how to deal with these diseases.
Thank you.